Hi, I'm Dr. Younger. I'm director of the Neuroinflammation, Pain, and Fatigue Laboratory. And here in the late summer of 2022, I'm starting a new collection of videos from my laboratory. I've done these videos periodically in the past, but this is an entirely new initiative to get information videos out very quickly and frequently. There are so many projects going on right now, and there's so many results to discuss and so many ideas to cover. I think this will be the most efficient way and also the quickest way to get that information out to everyone who needs to hear it. So what I want to do in this short introduction video is describe what this channel is all about. I want to identify who should be watching and following the releases, and I want to tell you what you can expect to get out of these videos. So first, what is this channel? So I'm a full-time biomedical researcher, and I have a particular focus on brain inflammation. So I'm developing treatments and diagnostic tools, usually involving chronic pain, chronic fatigue, and cognitive disorders. So the idea behind these videos is to provide a direct channel between my lab and the people who need to hear about the work that we do and who might be able to benefit from it. There's a lot of places where you can get information about the various conditions that you may be dealing with. There are, of course, the scientific papers when you can get a hold of them. Those can be very useful. There are news reports that cover the really big issues. There are science and medicine bloggers who can take the complex information and make it more accessible. And there are the nonprofit organizations. And they do talks and they do newsletters, and those are great sources of information. And there's also presentations at conferences that are now frequently put online. And there's YouTube channels, of course, where clinicians and scientists and other individuals are presenting this medical and science information. So this is just another source of information. It's not meant to replace any of those, but I hope that these videos will be an added avenue for getting the needed information. I know that science seems to move really slowly, and I agree it does. So I hope that these videos will be somewhat of an antidote to that by providing more frequent updates. Instead of waiting for years and years and years to hear what happens at the end of the study, now you can get updates at different points along the study. And so you know how things are progressing. There is so much going on right now. When I first started planning these videos, I jotted down all the topics that I wanted to cover first, and I had about 40 videos planned in about 45 minutes. And so there's already almost a year's worth of material that I want to cover if I do a video per week, and new things are coming up every week. So I just need to get started and start getting this information out as quickly as I can. So that was the first thing I wanted to cover. What's this channel? Second, pretty importantly, is who should be watching these videos. So here's the list. If you have fibromyalgia, you should definitely 100% be watching these videos. If you have chronic fatigue syndrome, ME/CFS, you should definitely be watching these videos. If you have Gulf War illness, same deal. You should be watching these videos. If you have confirmed or suspected long COVID, you should probably be watching these videos. If you have pain throughout your body, especially throughout the muscles of your body, and clinicians aren't quite sure what's happening and there are no treatments that seem to work, it's probably a good idea to watch these videos. Same thing if you have fatigue and you've gone to the physicians, but we can't quite figure out what's happening, it'll probably be a good idea to watch these videos. If you have one of the many pain or immune or fatigue disorders that aren't well understood by contemporary medicine, if you've got, just for example, mast cell activation syndrome or Ehlers-Danlos syndrome, irritable bowel syndrome, or post-Lyme disease, things like that, and there's so many others, you may want to tune in to these videos. There may be something helpful for you there. If you have an autoimmune disorder, if you have rheumatoid arthritis, or if you have lupus, or if you have multiple sclerosis or Hashimoto's thyroiditis, you might get something from watching these videos. If you have a condition that involves chronic inflammation in kind of any way, you might get something useful from these videos. If you have an age-related issue, age-related fatigue or cognitive issues, you may want to give these videos a watch. Same thing if you have a loved one, of course, a parent or a child that's struggling with one of these disorders, you could get something informative here. If you're a scientist or you are interested in a career in this field, then by all means, take what you can from these videos as well. So I think that pretty much covers everyone in the world now, so I'm going to stop there. And that was to answer the second question of who should watch. So let's get to the third one, which is what can you expect to get out of these videos? So my goal is to make videos that are informative and useful to patients primarily, but to anyone who has a concern about these areas. And I also want to make sure that the videos are grounded in the best practices of science. I don't want to sit up here and just make up stuff that I think sounds good. So my job is to discover and to reveal truths, and I want to share those. The other thing that you can get from these videos are answers to your questions. I know you have many questions, and unfortunately, I usually can't get to all of my emails to answer those, and so I plan to answer many of those questions here. So I hope they'll be helpful in that way. So my plan is to release a video every week. I will probably put those out on Mondays, so keep an eye out for them. And last, let me just do a little bit of expectation management so it doesn't interfere with the science we're doing. We stay very, very busy. The videos will be short. There will be no special effects. There will not be cool thumbnails. There will not be music. There will be no jump cuts to cover up the mistakes I make, no nifty edits or clips or graphics. There will be no celebrity guests. It's just me, my camera, and my tablet in case I need to draw something. The last caveat is we have the discussion area below the video, and you're welcome to use that to post questions. I will read those and I will answer some of them when I can, but I probably won't be able to get to everything, but by all means, use that. So if you can live with all of those warnings in return, you will get relevant information direct from one of the labs that's producing that information. So that's it. I hope that as you watch these, it becomes very clear that we're progressing as quickly as we can, and we're progressing constantly towards eliminating these debilitating disorders. And I thank you for watching this. I hope it's useful, and I look forward to sharing all the information findings with you. Thanks.